Unknown Legionnaire disease outbreak occurred at the American Legion Conference in Philadelphia Bellevue Stratford Hotel in 1976, and WHO identified this as the first outbreak. People named Legionella fairly killer. 1976 Legionnaire disease outbreak concluded that hotel old coolant tower and air conditioning system and water droplets act as the mode of transmission for Legionella to spread through American Legion and pedestrians between the age of 39 to 82. In total, Legionella made 200 people ill and killed at least 30 people, including a senior smoker. CDC's microbiology Dr. Joseph Mediate spent 6 months to discover Legionella disease as a bacterium and named it Legionella pneumophili. It makes people develop pneumonia when they contract Legionella. It is often associated with Pontiac fever, which is another different type of Legionellosis. Legionella present flu-like symptoms, pneumonia, and sometimes cause Pontiac fever. The conspiracy comes up with is fever killer another type of influenza or swine flu? During 1976 outbreak, most Legionnaires were terrified and refused to attend friends' funeral. Eventually, the science found out the air conditioning systems was the bacterial incubator, and Legionella can spread by water droplet and also from the biofilm on a pipe surface. Clinical perspective shows Legionnaire's disease is caused by Legionella pneumophila, a waterborne bacteria. It can grow in parasite and protozoa and spread through water droplet. It was detected in air conditioning cooling tower in 1976, but also Legionella can be at low water concentration area that created water droplet, such as water system, fountain, shower, spa, humidifier, etc. Warm water between 20 to 50 Celsius, 68 to 122 Fahrenheit is a sweet spot for Legionella to grow. Its common incubation period is between 2 to 10 days. Legionella also happen in VA hospital outbreak. Because most patients are vulnerable group, the material rate is between 5 to 10% among 60 years old patients who smoke cigarette, who has COPD, having chronic disease, or weak immune systems. 1 of 10 VA patients were dead. From National Notifiable Disease Surveillance System, data shows the rise of Legionnaire disease become a common disease, and there were more than 10,000 cases in 2018. But it is all possible to have Legionnaire disease outbreak if the water surveillance are not monitored well. In spite of the unknown etiology of Legionella, we can tell Legionella from its symptoms and patterns. The common symptoms are headache, fever which associated with Pontiac fever, chills, fatigue, cough, muscle ache, chest pain, headache, etc. How we diagnose Legionella? There are 3 common ways to diagnose Legionella. First, using blood and urine tests to test for Legionella antigens. Second, using X-ray to confirm if there are pneumonia in the lung. Third, test a lung tissue sample. And how we treat Legionella disease? The treatment for Legionella is oral antibiotics, fluoroquinolone, which is a treatment toward bacterial infection. Legionella is tough to prevent because it is associated with water. It is natural bacterial growth and spread through water droplet. That is extremely hard to prevent until we detect the outbreak. However, a well water treatment plant and water surveillance systems is necessary to minimize the spread of Legionella. Nowadays, we have a better national notifiable surveillance system from CDC, where to collect all the data from each state health department if the disease outbreak, such as a recent Riverside regional outbreak. The preventive measure for the Legionella outbreak need to focus on routine cleaning and maintaining all water pipes. Water treatment plants are under surveillance. Unused water towers should be drained. The water temperature control should be monitored on recreational water. About 60 Celsius of water can kill bacteria, but under 20 Celsius can only reduce the spread and growth of Legionella. Also, VA hospitals should come up with a frequent and efficient methods for water surveillance and protocol.